o'clock, and joining us in studio this morning, Joann Lopez with the Chaves County Health Council and Joann Palomino back with us. It's been a while since we talked to you at the New Mexico Department of Health. Good morning. Yeah, it's been about 3 years. Good morning, ladies. How y'all doing?
Great.
Good. A
little bit cold out there.
Yeah, it is
Just
this morning.
a little.
It's supposed to get nice though later today. So the coat you're wearing this morning, you're going to be shedding them by probably lunchtime
Right,
today.
right.
So, but first off, give us an update on the Health Council.
Yes, sir.
Of course, you guys have been pretty busy, and I know you had a little bit of a breather after
Lord.
the health fair here, which has been about a month now here, well, no, it's
August.
It was
Yeah.
August. Man, it's October already. What's happening? I feel
It's
like
just the year
time's
almost
zipping by.
over.
Yeah, I know.
Great.
But you guys have been keeping busy. So.
Yes, sir, we have. And, the year coming up again, we're going to start the projects all over again.
Good deal.
So as far as the Health Expo, we'll be calling pretty soon about sponsorships. Start getting that moving already.
August will be back before we know it.
Absolutely.
So,
Absolutely.
but you guys do meet monthly, and love to invite the public and more people that are interested in being a part of the Health Council to come out to these meetings.
Yes, and right now we're building our capacity. So this Friday we do have an executive meeting at 9 a.m.
Okay.
And it's via Zoom, so you would have to call either 211, and I could give you information.
Okay.
Or you could call 575-500-2294.
Okay.
And I can get the Zoom link to you.
Okay.
But if anybody that would like to just see what we're about, join a meeting and let's see if we can't get you involved and make our community a better place.
Well, and that's for folks that aren't aware, that 211 number is the Chaves County Health Council's kind of information hotline.
Yes.
If you need to help find a doctor or have any health-related questions.
Well, and not just health-related.
Community-related, yeah.
Anything, If I don't have a resource already, I send out an email to our
Get in front of that mic
council.
there so I can hear you a little bit better.
If I don't have a resource ready, I'll just send an email out to the council. And we got many members in various types of professions.
Yeah.
And, we get the information. We get a phone number. Now, we do not have the funds when you call in for us to give you the money for your rent or something like that.
Sure.
We give you the resource. And
Gotcha.
then you still have to do the work as far as calling and trying to get.
Sure. But you're there to help and offer
Absolutely.
solutions and give people options for, if it's that kind of stuff,
You bet.
or if you're wanting information about meetings and events
Absolutely.
and the Health Council or anything. That 211, obviously 911 if you've got medical
Yes.
emergencies and things.
Yes.
But if you're just looking for resources and things like that, whether it's to pay the bills or to find a healthcare professional or something in
bet.
between, 211 is a number to call.
Yes.
Is it like 911? You don't want people calling you 2 in the morning, do you?
If I hear the phone and wake up, I'll answer.
Gotcha.
And,
But
yeah.
if Joann sounds a little groggy, it is 2
Maybe
in the
give me the
morning.
wrong number, but it'll be okay.
But obviously if you're calling 2 in the morning, make sure if it's emergency,
Yes,
call 911, all
absolutely.
joking aside. But I imagine if you are having, some people just live different schedules, I guess.
Absolutely.
And Joann will help you when she can.
Absolutely. But again, the meeting, executive meeting is this Friday, and please just pop in and let's see if it's something you'd like to be a part
Yeah.
of.
Now, is there going to be a link to the Zoom on the Health Council's Facebook page
Yes,
too?
on the Facebook page,
Okay.
we'll have it on there also.
So if you like and follow Chaves County Health Council on Facebook, they'll find the link for this for the Zoom meeting there too.
Yes, sir.
But if you have trouble with that or you don't do Facebook, 211 is probably
Three
your
numbers, 211,
Yeah, that's the. I mean, you can call the 575, but why do extra numbers when you don't have to?
There you
Work
go.
smarter, not harder.
Absolutely.
That's, now you can save those fingers for later. More digits you got to do.
Absolutely.
So, Joann, kind of give us. I should probably Joann Palomino. I say Joann. I was like, what? Give it. What's. Now that we're living in the post-COVID world, life is kind of starting to return back to normal at the Department of Health as far as procedures and how you guys work with the public and handle the public and deal with the public. That you're kind of getting back to the way we used to do it, pre-COVID world.
Yes.
Now.
We just finished the 5-2-0.
Okay, you can grab your mic. We don't have to share a microphone, just a headphone. But,
Okay.
Good.
We just finished the 5-2-0 with Healthy Kids.
Yeah.
And we were in all the schools. We're still doing the diabetes classes. I
Yeah.
just finished the Prevent Type 2 class
Good deal.
in October.
So back to having the regular classes and things like you used to have.
Well,
That's starting to come back now.
Yes, the Prevent Type 2 class was virtual.
Okay.
So it was all through Zoom still, and we're
Gotcha.
going to still continue
Okay.
doing the classes through Zoom.
Well, and I imagine too, if a lot of that is talking, and you can get a lot accomplished through Zoom through that kind of
Yes.
meeting. Unless it's a session where you're cooking something or doing something physical, you could probably get the rope. You know what I mean? The rest you can do over a Zoom meeting. Talking progress and ideas and things like that. That's
Well, I continued having the classes, but I also had 2 chefs
okay.
actually cook.
Nice.
And participate
Wow.
in the class.
Good deal.
Nice.
So they got on and they demonstrated. They did all their healthy cooking and so forth. So it turned out really well.
Good.
Actually, it's my daughter Daniela from Texas. So I got her and her husband
Okay.
on to do the.
So were you in the room when they were cooking?
No, they were through Zoom. Through Zoom.
Well, the only bummer about that is you don't get to smell what they're doing.
Exactly.
You know what I mean?
Taste it.
It looks good, but something about the smell. That's what gets you. The smell gets you. You can watch it all day, but if you're in that room and you're like, is that chili?
Oh,
What
man.
is that? Oh, man, that's smelling good. It's going to get in the stomach rumbling. So, yeah. So that's, well, good. Well, that's probably a good thing. That way, now they got stuck eating all the leftovers.
They got. They were happy.
There you go. But that's great because that's something that when folks get either diagnosed pre-diabetic or diabetic or that that some people interpret that as like, oh great, death sentence. I'm going to be eating I'm going to be eating plant food for the rest of my life. Salads forever. And to be honest, that's not the case at all. It's you learn it's all about moderation and things.
Moderation and exercising every day.
But there's a lot of great alternatives now and things. It's ways to cook foods that even though you enjoy the food, but if you do it a traditional way or a certain way, it's much less healthy. But you do pizzas even like the cauliflower crusts and things like that cut down on carbs and things like that, which are no diabetic's friend. That technology or that science has gotten a lot better, and so you eat a cauliflower crusted pizza instead of a dough crusted pizza, and it still tastes like a pizza. But you're not dealing with all the carbs and all the stuff. So there is options there, and ways to do and recreate the things you love, and you're like, I am not living the rest of my life without pizza. You know what I mean, or ice cream or whatever it is. You find those ways, and that's where these classes help you find alternatives or just even portion control sometimes. Yes. It's like, hey, if you got a craving for ice cream, sometimes there's nothing that's going to satisfy that craving. But you know what you don't need to do? Eat the whole pint. Just maybe grab a spoonful or two and then satisfy that craving instead. But that's the kind of stuff that you guys teach is that, and then portion control, just education. Because, we all, I think all of us, growing up and, how we were taught to eat and things like that. And now they're finding, well, maybe, those rules we had as kids weren't always the best ideas, cleaning your plate or no this, no that, and, portion control. So we have skewed ideas on, we're eating healthy, things like that. And so these classes really do wonders for folks to kind of re-educate and tell them it's like, no, this is, think of it as fueling your body, and this is the things you need to put in it. These are the things that are good. These are the things you probably need to steer clear from. Right. That's the kind of stuff. And kind of, I'm showing my age a little bit, but I grew up with the food pyramid, the four food groups, and all that stuff. And that's all gone the way of the dodo now.
Absolutely. So, on education, the program that Joann took to the schools, my grandson came home and he was all into it. It was like the whole refrigerator got cleared out. We, 1 hour of exercise, 2 hours of screen time, and he just had us.
He got regimented with it.
He was really into it, so we helped him, and that educates us
Good.
Again because throughout years you forget what you need to be doing.
Well, and that's just it too, and that's where because some people, you can go gung ho, and you got to be careful there too because if you go all in, and then like a week later you're like and then you throw it all out, and so sometimes you're going to stumble and things like that, and that's probably where you deal with a lot is folks, It's life's a struggle. Some days you have winning days, and other days you don't win so much. And you in these classes and not only educate but kind of help socially and the mindset of it, and being your partners in, you know, anytime you're trying to do a new program or a lifestyle change, it's always helpful when you've got support to do that. People, either family or friends, to do it with you, or someone that you can talk to and ask questions. And when you're having moments of weakness or moments of not understanding what's going on, or you hit a wall, that's, you know, that's these classes come in and say, all right, now we got your buddy to work with you, or Joann or one of the instructors can sit down and talk with you about these things. So please, anything the New Mexico Department of Health is offering, it's free of charge. You pay your taxes for a reason. It's for stuff like this.
Exactly.
Well, and I had introduced the Veggie RX to Chaves County Health Council, so Joann's going to take it over.
Good.
And they're going to do Veggie RX program here in Chaves County.
Well, it's great that you guys are able to get back partnering with the local organizations again, doing this kind of stuff, like the Health Council, and working hand in hand. I understand as a government operation, you're very restricted on what they tell you to do and how you do it and all that. But now it's good to know that, keep signing for the virtual stuff. But if you want to go to the office and see a person and talk to them, they're there now. And so if you have those questions and all that stuff, for the health department, New Mexico Department of Health, kind of, because I know there's a lot of subdivisions and subsects of it. Talk about where, if people are dealing with the health stuff that you're doing, where do they need, what facility, and do they need to go and talk to, and what numbers do they need to call for that?
Okay, our facility moved to West 2nd, 1912 West 2nd.
Yes.
And then the telephone number, they're all different telephone numbers. Everybody has different telephone numbers. I can leave my number. Yeah,
like if someone wanted to learn about, say, the diabetes stuff or some of those classes, something that they would call you direct for.
Yes, they can call our office, or we're also on the website Pathways to Health. So all our classes are on there.
Okay. And is it nmdoh.state.gov?
nmdoh.org.
There it is. I had it till the dots, and I'm like, gov.org, I don't know, but .org, nmdoh.org, and you can go, and that's a great resource to just kind of put on your bookmark.
Absolutely.
Like if you're, whenever, obviously, if we have to deal with another pandemic situation, that's going to be a resource. But anytime you're looking for general questions about stuff, vaccinations or any of that kind of information, or child support, then that kind of stuff, you'll find the big flies are out. The weather's getting warm or cold, and these big flies just show up out of nowhere. I don't know where they come from. But
and Mike, I also wanted to, during this sit down, I wanted to introduce an organization that's a member of ours, and it's the Road to Recovery.
Yes.
And Joann's family is the one that is putting this on. So,
kind of give us a little bit of background on Road to Recovery and what this organization's all about.
So my sister Loretta Huerta, she's from Albuquerque, New Mexico.
Okay.
She is the lead.
Okay.
For the it's a new walk here in Roswell.
Okay.
It's going to be a 5K walk in January.
Okay.
And we're looking for resources for help.
Okay.
And so this is actually the first Road to Recovery.
Okay, so this is the grassroots. We're still kind of putting all the pieces in place for this organization. So looking for ground floor people to help with that and things like that. Now, is this Road to Recovery? Is this for substance abuse and that kind of
abuse, mental health?
Okay.
Yes.
So options for treatment resources, et cetera, for folks that need any kind of substance abuse help, or if they're ready to break free from the cycle of drugs or alcohol or whatever it is, they can put them in the path to recovery kind of thing.
Yes. And so my two nieces came together and said, we want to start the 5K walk.
Okay.
And so they've been meeting for about 6-7 months now.
Okay.
And then so I've just been introducing Loretta and her team to different organizations.
I got a phone number here. I think it's a different number. Why don't we, if you guys are okay with it, why don't we take a quick 1-minute news pause, and we'll get her on the phone, get Loretta on the phone here, and then we can have her talk to us direct.
Thank you.
Does that work for you guys?
Sounds good.
Okay, Tanner, we're going to take a quick commercial break here, and the rest of you. We're going to pause real quick for a local news update. While I'm doing that, we're going to get Loretta on the phone here, and then we'll get a chance for us to chat here.
Great.
So
That'll be great.
don't go away. We'll be back. You're listening to Mornings with Mike Winters.
Now for your Pecos Valley news update, I'm Jared Cirillo. Roswell police are discussing trick-or-treat safety. Remember that if it's going to be dark, equip yourself and your kids with flashlights. Also, avoid approaching any houses that are not lit at the door. Younger kids should always be accompanied by an adult or responsible older teenager. And remind your children that, if possible, try to move around the neighborhood on the sidewalks rather than walking in the street. The U.S. Department of Agriculture will waive cost-sharing requirements for New Mexico farmers and ranchers affected by the largest wildfire in the state's recorded history. U.S. Senator Ben Ray Lujan on Thursday announced that the agency will cover cost-sharing for emergency forest restoration, conservation, and other environmental improvement programs. The move follows the approval of a massive federal spending bill that included $2.5 billion in relief for those affected by the fire and post-fire flooding. That bill included a provision to waive cost sharing for all programs administered by the U.S. Department of Agriculture. You're up to date. I'm Jared Cirillo reporting.
Here's a Mornings with Mike Winters fun fact. Slugs have 4 noses, but no fingers to pick them. Here's Mike Winters.
And good morning. It is 35 minutes after 8 o'clock, and joining us back in studio, of course, we have the Joanns. We're just going to refer to you as the Joanns as well. But we were kind of talking about her right before the news break on the phone here. Loretta Huerta is joining us as well on the phone. Can you hear us okay?
Yes, I can hear you fine.
Awesome. Very good. Well, thank you for getting us in. Yeah, you guys are going to need to put those on so you can hear here. Now your sister can hear you. She puts her headphones on.
All right.
Here.
Hi, Joann.
Hi, Loretta.
So she'll have to talk to the mic so she can hear you there. But so let me ask. We kind of left off in the middle here. Talk a little bit about the organization. I know we were talking about getting in the grassroots here of and talking about this as a program for individuals that for substance abuse, mental health, and things like that. But Loretta, go ahead and kind of you were listening to us, so hopefully you can pick up kind of where we left off and just kind of give a little bit of background, a little bit of info about this organization.
All right. Well, there's a very sad story as the reason we started. We lost our youngest brother. There's 14 in the family.
Oh, man.
And to accidental overdose. We were devastated when we heard the news. He had just been out of prison 3 weeks and tried something that he found, and it took his life. The saddest thing is my brother, a doctor, pronounced him gone in the ER, and that shook our family, shook the nieces and nephews.
Man.
Together, there's 110 of us, so we're a big Roswell family. And we decided that something needed to be done. And our goal is so simple, to help one family. And if we can help that one family find the resources that they need, they won't possibly go through the heartbreak that we've been through, the heartache. And we've got a team that has tried all the resources out to see how difficult is it to access help that maybe low-income people might not be able to afford without insurance. And so that was one of our goals. And then what are the avenues for people that do have insurance? So that was our team effort. That's Alicia Anise, all the way in North Carolina, has taken on that role. But DOH, the Joanns jumped in and gave us so many resources that we're ready to go with that.
Nice.
But Dr. Sean Powell at ENMUR is the one that got us started, gave us a race list. We called Mayor Tim Jennings, and he said, anything you need. And so from there, Roswell Schools accommodated us with offering the Wool Bowl. And now we're seeking a sponsor, a nonprofit, so we can, run all the funds through them that we make in the race. But the goal is to get enough resources to provide to the community that they know exactly where to go for help.
Gotcha.
Because that is something we would have wanted for our young brother. And of course, now we just have this mission to do this. So January 21st, we're hoping for good weather in Roswell that
I'm knocking
day.
on wood as we speak.
Yeah, and it's a 5K, so it's for health and energy. But any connection we can make to DOH and get people aware, now that I've had time to research their websites, follow up on their referrals and their connections and their networking through the Leadership Council, and just the members at large throughout the Roswell community, people have been very helpful. So we're excited to bring an entire community together and hope that we can get it out there for a good cause. We're going to also run it virtually.
Okay.
We have family all over the United States that we would like them to sponsor, come on in, join the race, and then do it on their own time. But those of us that are in Roswell, let's walk together, because we'll be walking for our own brother, but there's others that are going to be walking for their families, because this opioid epidemic is taking way too many New Mexican lives. Did you know that we're number 12 in the nation right now?
Wow.
And that is not a good number to be. We are losing lots of people to,
it's
almost that's out there.
It's almost to the point, like you hear cancer. Every one of us is impacted by cancer, either directly or indirectly. Unfortunately, drug abuse and substance abuse and this mental health is the same thing. There's probably people listening that are in denial themselves right now in this audience that are dealing with and struggling with these issues and things like that. It touches all of us here, and guess what? It does not discriminate. It doesn't care if you're rich, poor, black, white, green, yellow, male, female. Doesn't matter. It impacts all of us, and that's something that we need to stand together and be in this. I've always been saying this. We need to Susan G. Komen mental health. That's been my mantra, and what I mean by that is, how much money breast cancer awareness and all that, and it's a good thing. But the Susan G. Komen Fund has done more for raising money and raising awareness and pushing research forward in that area. We need to do the same thing with mental health, and I throw substance abuse in that because I think they're one and the same. They go hand in hand.
Exactly.
I think substance abuse is
it's
a Band-Aid for a bigger issue, and
the pandemic didn't help anything, and then to all of a sudden. My brother's chance to go back to Roswell, start his life, and then not being aware of what these drugs on the street, where they're coming from, what they contain. Well, it was a little bit too much for his system. So we just want to educate parents. If we can reach someone who's addicted as well, great. They're up for a battle. The research shows that it takes a committed effort of just working together. But I know there's programs in Roswell. I think that Joann going into the schools and teaching our young kids, health measures and how to stay healthy will be even better, because I think the pandemic did really influence a lot of people with, really having to focus on mental health.
Sure.
And getting ourselves nice and strong. So we're going to try it, and our website will be up for November.
Okay.
So if you'll have me on again,
absolutely,
I will be gladly to promote that website.
Yeah.
And get some posters out to everybody, because right now, outside of your email, Mike, I think I have everybody's email that I'm going to send an email blast out to once we have that website up. So
okay.
We don't want this stigmatized. It's in front of us. It's here. Let's deal with it head on and not pretend that it's only for those people that, deserve it in some awful way. It's not. It's something that Roswell can be proud of. It can be a vibrant, healthy community. And we're just going to do our part.
Yeah. So kind of pencil in on your calendars. right now, January 21, 2023. If you haven't got your 2023 calendar yet, go get you one of those and put that first date on there. And then plan to be out at the Wool Bowl from beginning about 9:30 that morning. Obviously, as we get closer here, we'll give people the links to sign up and to learn more and to get more involved and to, because I'm sure there's some people listening, I'm hoping, and they're thinking, I want to do more than just walk around in a circle. I want to get more involved and get active here. So for you folks, we want you involved too, because mental health is something we as humanity needs to nip in the bud here. We talk about drug abuse and things and saying that's Band-Aids, and it is, but it's a much more dangerous world now with this. Once fentanyl entered the game, that changed things. I mean, cocaine and these things are never something you want to just pick up and try. That's bad deals. But casual, hey, some kid went to a party and said, try this for the first time. And now most of this stuff coming off the streets laced with fentanyl, and people are dying the first time they're trying this stuff. So we gotta, I'm not trying to condone dumb kids experimenting, because we're all kids and we all done dumb things and, had a beer or smoked a joint or, you do things. That's what happened. And you learn a lesson sometimes, but you don't get the opportunity to learn lessons with this stuff. It's killing people. And so we need to, keep kids from going down this path, but B, help the people that are using drugs as that Band-Aid to try to fix their problems. And unfortunately, some are very good at it. Some have been doing it there for a long time, others. And here's the other thing too, we all blame ourselves when you lost your family member. I'm sure half the family's like, we should have saw, you know what I mean? It's just, you blame yourself, you blame everybody, and it's not anyone to blame. It's, life happens and things. But at the same time, as family members, they're talking to your family, being with your family, understanding your family, their family fights. We get that. Everybody argues, Thanksgiving ain't complete with a good argument between an uncle and somebody, right? But it's, you just got to look out and keep on it. And that's what this program really, it's about getting everybody involved. And that's just it. Alcoholism and drug abuse and these things, they're diseases. This is what we're learning. This isn't just some people making, I feel like getting, no, it's much bigger than that. This is, they could be dealing with abuse, could be dealing with mental illness, could be all the above. And the one time they felt good is when they had that drink in their hand, or when they took that hit of cocaine or whatever it is. And that's how they cope with life. And unfortunately, it's not a recipe that you usually can handle for very long, and it just spirals. I mean, but we got to understand the mental health side. I think that's where we got to crack the code, and I think we just need to, have 100,000 walks, and we raise billions of dollars, and it goes to mental health research, and who knows, maybe by the time our kids are adults, they got a much bigger handle on this, and something like, who knows, schizophrenia or any of the things we're dealing with right now. They, hey, you can, there's ways to manage that, to treat it, to, God forbid, cure it, and this is what we got to do. So things like this walk and stuff, this is kind of like step one in going into that, turning it into your Susan G. Komen, and everybody's wearing designated color, and doing all the things to show support. That's great and wonderful, but it's the bucks that come behind all that stuff that makes the real difference. So, so please sign up for this walk, and if folks certainly want to get more involved, reach out to any of the Joanns. Just stand on the street and yell Joann, and one will help you. I'm just kidding, but get a hold of the New Mexico Department of Health. Call 211 for the Chaves County Health Council. They'll be happy to answer any questions or anything about this. Now, like, you're based in Albuquerque doing all this, and I imagine the rest of the family, they here with boots on the ground doing stuff. So, Joann, if someone's here in town and they want to talk, is probably you the best person to get a hold of, or should they call your sister? Or?
Call Loretta, because we have a committee. So there's Marisa Maiza.
Okay.
She's on the committee. And
okay.
There's a few others.
Okay. So, if anybody had any questions or anything, Loretta, about anything we're talking about, what's the best way to get a hold of you direct?
Okay, directly, I'd like them to use my email, which is Huerta.Loretta, Loretta, 58@gmail.com, because right now my phone is a little bit out of order. So I would really like them to reach out, call Joann's, either one, and they'll forward a flyer. They'll email a flyer that has all the contact information on it, because I know somebody knows somebody out there that is willing to help and sponsor and be a part of this great event. And we would love to have you. I would like to see representation from so many organizations in Roswell so we can reach those families that need the help the most.
I would even love to see, like, you know how we have Walk for Hope for the Chaves County Cancer Fund and things. It's a great event here in town. But they always have that survivor's lap at the beginning where they get all the folks that have beat their. Yes. What if we did something like our version of a survivor? You know, people that have overcome their addictions, overcome their things, and they're the ones leading the pack for that first lap. That might be a cool idea.
Beautiful.
You know,
what an awesome idea.
Yeah.
Okay, I like that.
All right, write that one down.
And then they know there's a community behind them.
Yeah.
And I love that idea.
Yeah.
Okay.
So but this is what we need people to get involved, reach out, and here's the thing: we all, like I said earlier, we all been impacted. We all either have a friend or a relative, or maybe it's us ourselves. We are all dealing with mental health issues. And especially the COVID world we live in. Even people, all of us are dealing with mental health. Some obviously different degrees than other, but. To a person right now, I'm sure if you asked them how they're feeling, most of them are going to be like, I'm okay, but, or, yeah, I'm this, you know what I mean? And some are going to be worse than that. But all of us, if you've been alive on this earth for the last 3 years, you're dealing with some mental health issues. It's just the nature of the beast here. And so we need to recognize that and help. You know, I mean, just look at the world we live in. You turn on the news and you see the things we see in the news. Does that look like people with rational minds doing rational things? Or does this sound like mental health issues that are going on? So, and how do we start it? One at a time, right here in the, like you said at the beginning, one family at a time, one at a time here. So let's roll up our sleeves and see how many families and how many people's lives we can change by just, you know, raising awareness, raising money, and putting people in touch with resources too. I imagine too, if there's any organizations out there listening that offer these kind of resources, that maybe that's not on Joann's radar or whatever. But Joann Lopez that time. Sorry, sorry, I forgot I had a bunch of Joann. And that way, you know, we can say, hey, all right, well, because that's really what at the end of the day, the health council is a conduit. It is that it's a gathering place for others to get the word out, to get things going. So it makes complete sense that the Health Council is partnering here with this to get this organization off the ground and everything here. So
yes, sir. Good
deal. Is there anything we didn't get a chance to talk about? Anything we missed or anything we wanted to share that you know, we got, you know, just forgot about, or I made some dumb joke about?
No, just for anybody that's interested in being a part of the conversation of the awareness of the abuse, whether it's drug abuse, alcohol, whatever type of abuse, just get a hold of us so they can be a part of this walk. And
tune into the executive meeting this Friday, the Zoom meeting.
Friday, 9 a.m.
And I imagine if you have questions about this event or getting involved, there'll be some people you can talk to about it at that executive meeting. And that's this Friday.
This Friday, 9 a.m. And you can call 211. And I can give you the Zoom link, or you can go to the Facebook page and get it from there.
Chaves County Health Council, look for that Facebook page there, too. And, of course, like you said, if you want more information about the walk here in January and this organization and getting in, come out to that meeting, call 211. Those are probably your two quickest, because I mean, it's pretty hard to forget 211. Remember that one, then you'll be good to go. So, very well. Thank you very much, and of course, Loretta, thank you for hanging out on the phone with us here a little bit. Greatly appreciated, and we'll get you back on here as we talk, as this event kind of grows and we get more information and details worked out, we definitely can't wait to get you back on to talk more about it. And who knows, maybe this thing gets big like Walk for Hope and everything. That would be great, wouldn't it? Where we got, thousands of people out there each year doing their thing and walking. Next thing you know, you're like, yeah, we raised thousands and thousands of dollars, or that's what we want to do, because every dollar raised is helping to fix this problem, and that's the only way you're gonna do it. If you're waiting for someone else to do it, you're gonna be waiting a while. That's how life works.
Well, thank you guys. So true your words were, and the council's been phenomenal to work with. Thank you all for your hard work and keep up the good work. So I appreciate your time, and more info coming, okay?
Excellent. Well, thank you very much for spending time with us, and we look forward to speaking again soon, okay?
All righty.
Awesome.
I'll keep listening. I'm going to say bye now. Thank you so much.
Thanks, Loretta. Take care. Bye-bye.
You too. Bye-bye.
All right, that was Loretta Huerta here. And then, like I said, if you have any questions about anything we talked about here, 211 Joann, or call the other Joann Palomino at the New Mexico Department of Health. Again, for what's your number there if they have any questions about diabetes or any of that stuff?
505-222-4634.
Very good. And that is the number. Or come by the office on 2nd Street.
Yes.
That's that office there. If you're going to one of the others,
right.
you're going to have to, you're going to get a nice tour of Roswell. Well, thank you guys. Appreciate it. We'll see you all next time,
Yes,
okay?
sir. Thank you, Mike.
All right. Take care. Don't work too hard. Eat and
And eat right.